Incredible how many steps are involved in creating a seemingly simple tooth-colored filling.
Each step is crucial for ensuring a successful and long-lasting restoration.
I'm definitely feeling a lot more knowledgeable about the entire process now from start to finish.
And I bet our listener is too. They're probably starting to feel like they could place a composite restoration themselves.
But before they go practicing on their family members, let's talk about one more important aspect of composite restorations,
Okay.
their long-term care and maintenance.
Right.
We want to make sure these restorations stay looking good and functioning well for years to come.
You're absolutely right. Maintaining composite restorations is just as important as placing them correctly.
So what can patients do to keep their composite fillings looking and functioning their best?
The good news is the advice is pretty simple. Maintain good oral hygiene.
Okay.
That means brushing twice a day with fluoride toothpaste, flossing daily, and visiting the dentist regularly for checkups and cleanings.
So the same advice we give for all teeth applies to composite restorations as well.
Right.
It's all about keeping those pearly whites clean and healthy.
Exactly. Plaque and bacteria can accumulate around composite fillings just like they do around natural teeth, leading to decay and discoloration.
And I'm guessing certain foods and drinks can also stain composite fillings.
You're right. Highly pigmented foods and beverages like coffee, tea, red wine, and berries can stain the surface of the composite, making it appear, dull or discolored.
So it's best to enjoy those things in moderation and brush well afterward to keep those stains at bay.
Right.
Okay, so good oral hygiene is key.
Yeah.
Are there any other special considerations for maintaining composite restorations?
Well, it's important to remember that composites are not as hard as natural tooth enamel, so they can be more susceptible to wear and tear over time.
So chewing on ice or hard candies is probably a no-no.
Definitely. Those habits can put a lot of stress on composite fillings, leading to, chipping, cracking, or even fracture.
And I'm guessing grinding or clenching your teeth can also be problematic.
Exactly. Bruxism, as it's called, can wear down composite restorations prematurely. If you grind or clench your teeth, your dentist might recommend a night guard to protect both your teeth and your restorations.
Okay, so it's important to be aware of these habits and take steps to protect your composite fillings. But it sounds like, with proper care and maintenance, composite restorations can last for many years.
Absolutely. They can provide a beautiful and functional smile for a long time, as long as you take good care of them.
Well, this has been an incredibly informative journey through the world of composite restorations.
Yeah.
We've covered everything from the composition of the materials to the intricate steps involved in placing and maintaining them.
It's been a comprehensive exploration of this fascinating field.
And I bet our listener is now feeling like a composite resin expert.
They're probably ready to ace those dental school exams or even consider specializing in restorative dentistry.
Okay, we've covered different types of composite materials. We've talked about the steps involved in placing a restoration and even how to care for them long term. But one question I still have, how do dentists decide which composite to use?
Ah, yeah.
It's like walking into a paint store with 1,000 shades of white.
Mm-hmm.
How do you even choose?
That's a great analogy. And just like choosing paint, you have to consider what you're trying to achieve. In dentistry, that means thinking about the specific needs of the tooth and the patient.
So what factors come into play when selecting a composite?
Well, let's say you're dealing with a large cavity on a back tooth that's, under a lot of chewing pressure.
Right.
In that case, you'd probably prioritize strength and durability.
So a composite with a higher filler content.
Exactly. You need a material that can stand up to those heavy chewing forces. And we also have to consider polymerization shrinkage.
Right.
That slight shrinking that happens as the composite hardens.
Yep.
It can be a bigger issue with larger restorations.
That's where those newer composites like Ormos Caris
Right.
and Silurine composites come in handy, right? They're designed to minimize shrinkage.
Precisely. They're like the premium options, offering extra benefits to address specific challenges.
Okay.
But sometimes the standard options are perfectly adequate.
Right.
For a smaller cavity on a front tooth where aesthetics are the top priority,
Yeah.
a microfilled composite might be the best choice.
So it's all about choosing the right tool for the job,
Right.
considering both the functional and aesthetic aspects of the restoration.
Like, exactly. And that's where a dentist's knowledge and experience come in. They have to
Yeah.
assess the size and location of the restoration, the patient's bite, their habits, even their aesthetic preferences, to select the most appropriate composite.
It sounds like there's a lot of thought that goes into choosing the right material. It's not just about grabbing the first composite you see.
Absolutely. It's about customizing the treatment to the individual patient. And that's what makes dentistry so fascinating. It's this blend of science, art, and problem solving.
Now, before we wrap up, there's one thing I want to revisit, that hybrid layer we keep mentioning. Can you
Mhm.
explain it one more time? Maybe with an analogy even I can understand.
Sure. Imagine you have a piece of wood and a piece of metal, and you want to glue them together. Now, wood and metal don't naturally stick together very well. You need something to help them bond.
Okay, I'm with you so far.
So imagine you use a special adhesive that's designed to bond to both wood and metal.
Okay.
That adhesive kind of seeps into the tiny pores and irregularities of both surfaces, creating a strong interlocking bond.
Okay.
That's kind of like what the hybrid layer does in dentin bonding.
Ah, I see. So the bonding agent is like that special adhesive,
Right.
and the etched dentin is like that porous surface of the wood.
Exactly. The bonding agent penetrates the microscopic spaces in the etched dentin, creating a strong, intertwining network that anchors the composite to the tooth.
And it's called a hybrid layer because it's a blend of the bonding agent and the dentin.
Precisely. It's a zone where those two materials merge and create a strong, inseparable bond.
Okay, that makes so much more sense now. Thanks for breaking it down for me.
No problem. It's important to make sure those key concepts are crystal clear.
Well, I think we've covered just about everything there is to know about resin restorations. From the chemistry of the materials to the artistry of placing them, it's been an incredible journey.
I agree. It's a testament to the constant innovation happening in dentistry.
And the biggest takeaway for you and for anyone listening is that composite resins are constantly evolving,
Yeah.
always pushing the boundaries of what's possible in restorative dentistry.
Absolutely. So as you continue your dental journey, keep an open mind and embrace new technologies and techniques, and never stop learning.
Well said. The future of dentistry is bright, and with continued research and development, we can create even more beautiful, durable, and lifelike restorations for our patients.
It's an exciting time to be in this field.
And on that note, I think we've reached the end of our deep dive into the fascinating world of resin restorations. We've covered a lot of ground today, but hopefully you've come away with a deeper understanding of these tooth-colored wonders and the incredible science and artistry that go into creating them.
It's been a pleasure sharing this journey with you and with our listener.
Thanks for listening, and until next time, keep those dental questions coming.